Welcome to the CereCore podcast, where we focus on the intersection of healthcare and IT. From practical conversations to strategic thought leadership, let's unpack the decisions, challenges, and journey of those whose purpose is to deliver technology that improves healthcare in their communities. All right, today we have Rick Keller joining us as a guest for the podcast. Rick is the Senior Vice President and Chief Information Officer at Ardent Health Services based in Nashville, Tennessee. Welcome, Rick. It's been wonderful knowing and working with you for now a number of years and really look forward to our conversation. So thanks for joining the podcast.
Thanks, Phil. Appreciate it.
Well, want to just start off with a little bit about yourself. I know that you've been in healthcare for a few years now. Won't really get into the exact number of decades. But if you would, just maybe take us through a little bit about your career and then touch a little bit on Ardent Health itself and your role there.
Thank you. Yes, I've been in IT for a little while, if you might say. So thinking back, I think really deciding on a career in computers and technology while in college, where I changed from an engineering and architecture start, was really, I think, pivotal in where I sit today, as you can imagine. First half of my career was really spent with financial services industry and IT. And so learned a lot of valuable lessons in that area that I think I really brought forward to healthcare IT. And so the watershed moment for me really is when I joined Ardent over 14 years ago. And so it has been very challenging in different ways than the first half of my career, but it's been very rewarding. And working, as we work in healthcare, it just really gives you a sense of purpose. And when you're helping others care for patients. And so I've really enjoyed the time that I've been in this role and at Ardent in particular.
Oh, that's excellent. You certainly make mention of the fact that everything that we do in IT, it has direct correlation to that patient care. And I think back to when we first started working together back in 2016. Ardent was going through a large Epic implementation and was looking for an organization to help them with legacy support, so you could sort of transition some of those people over to the Epic project. And and thinking about those sorts of large investments really that an organization makes, so many times you often go, well, why are you doing it, right? Why are we making that investment? What do we hope to gain out of that? And I think you touched on a little bit, right? Ultimately, it's that efficiency, satisfaction for physicians, nurses, clinicians, and ultimately better patient care. From an outcomes perspective. So, maybe talk a little bit about what your approach has been, to quantifying that process and measuring it on a go-forward basis as an organization.
Sure. As we all know, or most of us find out, measuring ROI for an EHR implementation in particular, when you are replacing legacy systems. In our case, in 2016, we had to make a decision because one of our core applications and EMRs that we were using had a sunset date that was set upon us. So we needed to make a decision, and it was really pivotal for the organization because we had to get it right. And we did a little bit of due diligence when we looked at a cost model that we were putting together. Epic really seemed to fit what our needs were and what our growth and strategy was. So aside from reductions in maintenance of legacy systems that can get displaced, and in our case, we were able to reduce our application portfolio by over 100 applications. And so we were able to pick up a return in the net of our new Epic maintenance versus all the maintenance from 4 to 5 different EMRs that were in use in the enterprise. So those are some hard type of returns that do have a limited, really, lifespan, because once all of that run out is accomplished, then we started to look in other areas that were not as hard dollar savings in a sense, but we found physician recruitment increased because most of the medical schools and their education, physicians are educated on Epic. And so they would look to go to organizations that were deploying or using Epic. So we've really been able to maintain a high caliber, high efficient physician and clinician workforce. I think the other areas that we've looked at is in our ability to collect cash more quickly. So the days to collect really increased with our use of Epic and the EMR. And also an area that we measure is our clinic throughput. And physicians, how quickly can they see patients? How quickly can they move throughout their day? And the efficiency of having, one patient, one record that you can see between the clinic and a hospital setting. And then over the last 2 to 3 years, we've really started to invest in some of the technology around MyChart for patients. We've had an initiative over the last 12 months that came from our CEO. It's called, we need to ban the clipboard. We need to get rid of paper forms for registration and problem list and other things. So we've had significant improvement in that, where we have gone year over year in the last 2 years, an increase well over 500,000 submissions of online questionnaires pre-visit,
Wow.
pre-appointment. We are getting more, we're almost 30% now of online payments via the MyChart application or mobile application. And so we're seeing the elimination of some of that in registration setting use of paper, where it really, as we all know, as we are patients at some point in time, you feel like you fill out the same information.
Exactly.
I'm allergic to sulfa. I tell you every time. So that's some of the ways that we're beginning to measure some real efficiencies and hard dollar savings and elimination of expense.
That's fantastic. And I think, you hit the nail on the head when it comes to just all the different areas that go into those, and all the different measurements from hard measurements from an ROI perspective to soft measurements to workflow to satisfaction, because it all plays a part. And in those decisions, whether it be a large EMR rollout or other projects. So, that makes great sense. So, we certainly do a lot of work with you in and around help desk. And so I wanted to, ask you a little bit about that. When you partner with an organization to provide, support, it can be a daunting proposition for IT leaders and organizations. Certainly there's a lot of factors that go into that decision. Maybe if you would just share with our audience a little bit about, how did you know the timing was right? How did you, come to the conclusion that the partnership was right?
Certainly, thinking back to 2016 timeframe, happens to coincide with the Epic implementation that we were starting to embark on. And we had our own help desk in-house. It had averaged from 10 to 18 to 20 help desk analysts. And when we really stepped back and looked at the management, cost of management of managing your own help desk, once you set aside one of the biggest obstacles, which is you think of a loss of control. And so once you can resolve yourself to, well, let's put a partnership together where we still have equal control. A help desk is not a core competency of our IT organization. And so we realized it was hard to recruit, it was hard to retain, and our service wasn't stellar to begin with as we started to grow. So that was a key point for us, is to first acknowledge this isn't what we do best. Let's find someone who does. And so as having the advantage of being in Nashville and such a deep knowledge base of services and companies, we looked at, and we're working with you guys already doing, as you mentioned, some of our legacy support. And then we looked at, why don't we try to build something together around Help Desk and Epic and different things. And so I think that's key, to look for a partnership that you can grow together with, that you look for someone who helps improve your services, not just deliver it. And that's where I think our partnership has been so successful. And we've been able to add in more than just answering the phone and pushing the ticket somewhere. Over this time, we've grown to where we share in the first call resolution metrics and satisfaction for our clinicians and users. So I think once you decide that it's something you really don't do that good at, find somebody who really does, and then just work together.
Yeah. Now, you threw out a term there that a lot of organizations use, right? And that's this concept of partnership. And I think sometimes it gets overused. And I've talked to a lot of CIOs that are very jaded when it comes to that word. However, I do think when it actually is a true partnership, like you mentioned, it's a shared responsibility, and that lack of control doesn't exist. It's not that you're just pitching something over the fence and saying good luck. It truly is, no, we're going to bring together two organizations and work together for that common goal and need. And I think if that's the mindset, like you mentioned, then success will follow. And I think when we partnered with you, we certainly worked through the years and added a lot of metrics and things along those lines when it comes to that. When you see from a help desk perspective, you see a lot, right? and as that gets documented and the teams work together, there's a lot of I would say analysis, right, that comes out of that. Can you think back over the past couple of years, and have there been any of those aha moments where all of a sudden that data that came out of that relationship went, ooh, yeah, maybe there's an area of focus here that we need to have, or maybe there's something else that we can be doing as an organization to increase the level of knowledge or understanding, whether it be in a physician group or clinicians or whatever.
I mentioned first call resolution, and there were really a partnership as we worked together to reduce the number of password resets, and just those things that are blocking and tackling, that they're almost the same thing every time. But how do we not just handle it very quickly? How do we eliminate the need for it? And so, in working with some of the metrics we've been able to track, and we've been able to see as we work together to implement things, and as we've matured, we now have our passwords expire after 12 months. It's a more complex password, but when the password is used over and over, you remember it. It's complex. It may not be compromised, but that has reduced the number of calls that come to our service desk that need a password reset. Implementing newer technology, as we measured, for example, in our UT East Texas market, where we had hundreds and thousands of calls when our user's ID or password, they had a lock. It was locked out. Well, it was due to aging hardware. So working in CereCore, helping us measure how many they were getting of these, we've been able to measure, implementing newer PC technology due to Epic and our workstations and endpoints. We eliminated these ghosts in the machines that kept locking out a user. So it's the ability, I think, to measure the impact and look for root cause, and then measure the improvements that we couldn't do on our own and wouldn't have the ability to invest in those types of tools that show those metrics and measurements.
Yeah. Great example. Great example. So, yeah, I want to pivot for the last, a couple of topics, more to just kind of some industry trends. So before pandemic, Ardent was already taking advantage of telemedicine. And certainly you've made mention of the work that you all were doing with the Epic MyChart, the patient portal there. As you look at that. I'd love to get your take and perspective on the future. When it comes to, all right, we did telemedicine. It was really, really important via the pandemic. What's it look like now? What's that patient engagement going to start looking like now from a patient portal standpoint, whether it be Epic MyChart or another patient portal, whatever it might be for organizations. Where do you see that kind of consumerism drive, or that whole concept of leveraging that portal in more meaningful ways going over the next, say, 3 to 5 years?
Certainly. Give you a little bit of sort of our journey and our path. Pre-pandemic, we were doing a lot of planning for telemedicine. We were stuck in the planning. We were stuck in the, well, will they really use it? Will we get reimbursed? Will it be a true service? Right. And so we were able to leverage that planning, though, right when the pandemic hit, and we stood up the ability for televisits and video visits, what felt like overnight. And so that has continued, and it's continued to mature. And again, whenever I start to talk about these things, Epic is such a great platform to build on, because you do have offerings embedded within it, as you all know, having support some of the Epic hospitals in your ecosystem, that you can really just build upon that. It's seamless through the different tools, so it doesn't feel like you're jumping out and adding into something else. And that leads me into really where our organization, along with others, there's a lot of disruptors that want to get into healthcare and start to provide what they really have, very, very sophisticated consumer type applications or offerings. But what's really difficult is how hard and complex healthcare is. So we've got that part down. We've been doing that. So where we're now looking at is we're trying to meet the patient where and how they want and need care. And so many things you can do on your cell phone, your iPad, or at your desk, home computer, laptop, if you will. People don't want to make a call to the office of their primary care physician and be told in 3 weeks, we can get you in. Mm-hmm. Life just doesn't move that way. So we're trying to move as fast as life for our patients, and create the connection to them long term by providing ways to schedule online. As I mentioned, fill out questionnaires online. Find a care setting that meets what they need, if it be an urgent care, before having to go to the hospital. So we're really trying to create an environment to where they can find the provider that they trust, find their locations that are easy, and get in and out and not have to navigate through a myriad of processes, and just streamline the experience as quickly as we can. And then build affinity with our patients. So when they come back, we know that they've been with us before, and we can then have a lot of information that we tell them about. And then they're going, oh, you remember me. So it's really simply creating a way for the patients to be seen where they want to see and how they want to be seen, because somebody's going to do it.
No, you're absolutely right. And that whole concept of being known is comforting, particularly as you're going through, whether it be chronic or just individual episodes. So it's important, and love hearing that from your perspective. Yeah, you made mention of it, right? Healthcare is complex. It's crazy, and quite frankly, man, it's rapidly evolving, ever changing. The past few years have really shed light on that, and it's one of those industries that that the passion of helping others and solving problems is just there day in and day out. But it's a rapid pace. So, what I'd love to hear from you is just a little perspective. How do you keep up with that pace? How do you keep up with all of the things that are happening, and staying in tune so that as the IT leader of Ardent, can be there from a strategic standpoint, helping the organization kind of see what's on the horizon, and how they might leverage technology to address those needs, not only today but also of the future. So maybe that some just if there are some publications or things that you look at, or things that you subscribe to, or things that you do that to grow that knowledge base, not only personally or professionally, that the audience would be interested in tapping into.
Certainly. I don't think I have really anything that novel from sources, if you will, but what I think we sometimes lose sight of or don't carve out is building that margin of time in your day to read and just research, to just our profession, our career is constantly changing. As you mentioned, you have to be a life learner. So, I try to look at, CIO information that's online, whether it be in modern healthcare or other places, but also then bring it closer to last couple of years, I joined Inspire CIO, a Tennessee CIO-based network of my peers that is cross-industry. And that's what I think is so important about this one is I have a CIO friend now and colleague who is CIO at Nissan here in Nashville. Well, we have some core infrastructure things that are very similar. And then I meet and go to lunch with other CIOs here in town, and because we commiserate, and we there's no competitive advantage that we could share. Right. Otherwise, somebody may think, what are those three doing together? Is somebody going to buy somebody? But we just really share the struggles and challenges and successes that we have. And so, Chime is another place, the fall forums and things that we've even, partners like yourselves meet up at. And so that's where I think sharing cross industry, as well as things that are working for us within healthcare, help me stay abreast and try to keep pace with. And then not only, our going to our user group meetings in and around Epic and other major partners in technology that give us, we kind of tell them our problems. They go off and build solutions or directions that we can hopefully meet up with and marry up with at some point.
Oh, it's a great point. And I think what we've been hearing from a lot of leaders like yourselves over the past couple of years is kind of that move away from everything operations into, wait a minute, I need to be that strategic leader. And at the same point, how do I get there? Well, I get there through that, taking that time to learn, taking that time to network, taking that time. And you hit, I think this is, something that's now beginning to gain momentum, is that I'm going to look outside of the industry. And so, I love that you brought that up and made mention of it, because there are things that other industries have done for a couple of years that are relatively new concepts in the healthcare market. Whether it be it's been just a different progression, different need structure, different, whatever it might be. And so I think, you're spot on with that, and that you've got to take the time, you've got to make that discipline, and then it's got to be comprehensive in nature. So, I certainly love that approach. I'd love to wrap up with, and this is something that we've been really focusing on with healthcare leaders, not only in the IT side of things, but also from the board level down through the CEO, COOs, CMIOs, but also CFOs. And that's that whole concept of just team, right? So, in the concept of you as a leadership group buying into the same strategy. And then, how I'd love to hear just a little bit about how, you see that playing out in your, everyday life. How do you get on the same page with your clinical leadership? How do you get on the same page and communicate effectively with a CFO? They speak a completely different language than IT. So, sometimes that translation is a little bit of a challenge, but it's critical when you're all trying to achieve that strategic initiative. So, I'd love to hear just a little bit about, how do you do that? How do you have that balancing act? And what is a successful relationship between all those entities look like for you?
For us, and some of your listeners may not, we've gone through an executive leadership change over the last 2.5 years, and so as part of that, we've had to establish those new relationships and working relationships, and I think we really just have tried to focus on communication and alignment. And so for me in particular, everyone is my customer. And when I approach it that way, I have to manage and communicate out, because up is one way, but really managing and communicating out is more successful in that we need full transparency of what is going on in the ITNS organization, from our budgets, from our strategic direction, from the normal things that help keep operations running, that then create margin for us to try to do innovative things that hopefully will move us toward those goals that we talked about earlier.
Yeah.
And so I think just creating lists of things that we're working on, pairing them up to the executive owners and stakeholders so they know. So that also helps all of the senior leaders in the organization know that what they're working on and how it fits into somebody else's. And if it's slowing down, understand, well, it's because we had to focus on this objective over here. Then we'll get to that piece of it. So I think that's just an approach that we've taken, trying to communicate and monthly meet as a senior leadership team across the entire enterprise, over 24 people coming together monthly to share information, and as well as just update each other on how the organization is working. And I think you measure success by the lack of surprises. You don't want to be or surprise any of our executive leadership team or others. And so, especially in our world, if we're pushing something out into the enterprise for security reasons or for other reasons, the last thing we want is to generate a bunch of calls to our service desk or a bunch of information or what is that? So communicating ahead of time, no surprises, is one of our key measurements of success.
I think that's brilliant, and I love your concept of communicating and managing out. So many times people talk about measuring up and down, managing up and down. I think you're the first one that I've heard mention managing out, and I love that. So that's a great take and perspective, Rick. Really appreciate it. So, as we wrap up, certainly appreciate your time today. Appreciate the partnership that we've had. Are there any last thoughts that have kind of come to mind as we've been having this conversation that you would love to share with your colleagues who may be listening to this podcast?
One of the things that just quickly comes to mind is, you can imitate to innovate. Didn't come up with that on my own. It's something Epic and their team share with us, because if you're going back to that life learner, you're looking at things you don't have to come up with. It's never been done before.
Right.
Because it's new to our organization, but somebody else did it, it's still innovative for us.
Yeah. Yep. That's a great point. That's a great point. Well, Rick, again, thank you so much. Appreciate your insights and look forward to many more years to come.
Thank you. Thank you for thinking of me to do this. I appreciate that.
Excellent. Thanks for listening to the CereCore podcast. If you like this conversation, check out our other episodes. Visit us at CereCore.net to learn more about our IT services and connect with us on LinkedIn. At CereCore, we are healthcare operators at heart and know the difference that the right IT partner can make in delivering quality patient care 24/7. Let's help make IT better. Here's to the journey.